Hello, and thank you for joining us for the Getting to Know WWO Transforming Preschool in Ethiopia. Today, I will be joined by three panelists. Melissa Middow, our Chief Program Officer at WWO. I am also joined by our Country Director, Dr. Sophie Mengistu. Dr. Sophie has been with us for 15 years, and she is the Country Director in Ethiopia. I will also be accompanied by Genet Zewdie. Gannet has been a preschool teacher in our schools in Addis, and she is also the element of play coordinator for our Ethiopia team. So welcome all. I'm so pleased to see all of you here today. Hello, Melissa. Hello, Dr. Sophie. So Gannet will join us when her internet comes back in, but let's start with our conversation. Dr. Sophie, I know there's been a lot of progress that has taken place in Ethiopia with the number and the amount of children that have been enrolled in school, in preschool and in general in school. But that hasn't yet translated into increased education and increased economic success. Could you talk to us a little bit about why that is happening and why the enrollment doesn't necessarily become success academically?
Okay, as you mentioned rightly, in 2015, the net enrollment rate in primary education for Ethiopia was 85.6%. But on the other hand, the adult literacy rate was only 51.7%, which is very low as compared to other African countries, let's say. This was a data from 2017. So the low enrollment rate in the rural part of the country and attrition are the two reasons why adult literacy rate is low in Ethiopia. But when you come to pre-primary education, 50% do not have the opportunity to be enrolled in preschool. So which determines the success in higher grade levels. So as you know, the great philosopher once said, like, give me a child until he's 7 and I'll show you the man. Okay, so there is a lot to be done to support children to be enrolled in pre-primary educations, not only like in primary school. So though access to primary schooling is substantially improved the last couple of years, primary school completion rate is still an issue for the country. And it needs to be addressed by the government and policymakers. Of all the students enrolled in primary school, about 30 and 47% dropped out before reaching grade 5 and 8. This is very alarming. So this evidence shows that dropout rate is higher in this particular age group between 5 and 8 years old. So
can you describe why? Why is it so high at those points in their educational trajectory? Why are dropout rates happening at such an alarming rate?
Yeah, the thing is, like, there are so many factors, you know. One thing is, like, these students are not in a conducive environment. Let's say in the classroom, teachers are forced to teach like diverse group of children at different age levels. So this impacts like the learning teaching process because they're dealing with like older children. Let's say like 10 years old child is like in a preschool, while we have another child who's like 5 years old. It's really difficult for the teachers to deal with this problem. And even at a younger age, you know, students could be the sole providers for the family, and they're forced and exposed to child labor, and they finally like drop out from school. And, you know, because of extreme poverty, you know, students come to school with an empty stomach. So this is before the establishment of the school feeding program at a larger scale in the public schools in 2019. That was started pretty much like 2 years ago. So this has resulted in children lacking the necessary focus required to participate in classroom and be promoted to the next grade level. And, you know, many classrooms operate with an average of like 50 students. It can be reached up to 80. So you can imagine. So this doesn't allow much individualized attention for the children. And, you know, these are some of the reasons specifically related to the students, but there are many other implementing factors for the high dropout rate related to the teachers and the overall school system.
Thank you, Dr. Sophie. Melissa, do you see any similarities between what's happening with the educational system in Ethiopia and what's happening in our other countries?
Yeah, Claudia, thank you. And Dr. Sophie, thank you for such a thorough response. I think what's happening in Ethiopia is it can be talked about in a more of a global sense, that education around the world is struggling. In Haiti, the same issues are faced by children. They go to school with hungry bellies. They haven't had breakfast. They might not have had dinner the night before, so they can't focus. The grade levels, children are often starting school late because of the cost of schooling. And so you end up, like Sophie said, with, you know, children who are 8, 9, and 10 years old in a first grade classroom with children who are 5 and 6. And so teachers trying to deal with the mixture of ages, the size of classrooms can be overwhelming. In Bulgaria, we're looking at issues of language being a factor, especially for the Roma population when they're entering into the education system and they're speaking the Romani language at home and trying to learn Bulgarian when they enter can be difficult. And in Vietnam as well, there's maybe for all of the countries, learning that comes with fear. There's a real fear base to learning, which I think echoes across all of our countries.
And I think what you're pointing to is kind of a fear-based paradigm for teachers, that they must instill fear to control the child. And this is because they really have such a mixed group in front of them. They have 5-year-olds, they have 10-year-olds for the reasons we just described, and they have an inordinately large group of children of different focuses, of different ages in front of them. So they have very little in their toolbox when it comes to how do they teach these children. So I guess that beautifully brings us to our next question, which is, how does the work that WWO has been doing, training the preschool teachers, help address these situations? And I think everyone on this panel can have some direct response to that question. So can we start with you, Dr. Sophie, and then we'll move through the panelists?
Okay, so we started supporting government schools and public schools in Ethiopia. So working with four schools who have like 90 teachers and over 2,000 students. So in one of the schools, we have like 600 preschoolers. So we did a training for the teachers on play-based learning and the methodologies, and we set up where the kids can come and play, and that will also be translated in a classroom setup. But most of the conditions mentioned earlier are beyond the capacity of the teachers to fix. But their contribution to scale up the teaching methodology could not be overemphasized. You know, even though play-based learning methodology is incorporated in the school's curriculum, you see it in the curriculum, in the syllabus, but it has not been applied in a goal-oriented or structured manner. This is a big drawback. You know, the teachers are now motivated to do more after the training they have received on play-based learning. So they witnessed that the students can easily develop, you know, social skills besides fostering critical thinking and communication, the EOP Learning Center. And this further helps them to focus and enjoy being at school. You know, when we observe a child within the play center setup, you can see like a child by playing like with a single toy, a child can learn life skill, sharing, you know, waiting for turns, problem solving, and at the same time learning like his or her colors, numbers, alphabets. So this is just amazing. You know, the teachers, you know, take for granted what play means for these children. So this is why the teachers are motivated to do more after the training. And, you know, the good thing is now they've started taking the toys into the classrooms. So they started incorporating it into their daily lesson plans. So they take toys which are related to the day theme, to the daily lesson plan. So the kids are excited because they've seen that particular toy at the learning space. Now they have it in the classroom. So this will be like a reinforcing factor for the children to learn well and to focus well.
Which is beautiful because now it's a positive reinforcement model versus a negative reinforcement that we found out doesn't work. Exactly. It doesn't work with the children. So this is a real groundbreaking learning tool, teaching tool for the teachers, which makes them feel so good and so empowered. Thank you, Dr. Sophie. That makes me feel so hopeful about how these teachers are now learning a new way to reach the children and reach them more effectively. That is beautiful. And you mentioned that there was before the training, the teachers really felt that route memorization was the way to go. There was only one way to teach, and you need to hit your ruler on the desk and say A and B.
Absolutely.
But after the training, a huge majority, 91% of the teachers that were trained felt that this way of teaching, play-based learning, was a much more effective way of teaching children, which when I read those results, I was astounded and so happy that this had happened for these 2,000 children and really for the teachers, because they want to be effective teachers. That's what I think we really need to remember. So, Dr. Sophie, you've been fortunate enough over the 15 years that we've been fortunate enough to have you as our country director with WWO in Ethiopia. You've worked with both the youth, with positive youth development, and with the children in our preschool. I wanted to touch upon how you've seen the educational dropout rate and the lack of education that has been involved in the teaching, how that has affected the economics and how the community is negatively affected economically by the kind of the failure in learning that's happening in the classrooms.
So there have been several teachers' education policy challenges throughout the years. But at the same time, with the development of new strategies that work within the Ethiopian context, there were like so many research why the education system is not being translated to like economic growth. But there are so many factors that are affecting the economic growth for a country. It's not only education. But, you know, when we take like the education system, the classroom setting, you see like lack of resources, you know, even they don't have like enough chairs to sit, especially like in the countryside. They don't have the appropriate equipments to teach their children. So that's why they focus on like rote memorization, because they don't have like supporting gadgets for the pedagogy to help the children to develop like life skill. And the teachers don't have like enough refresher trainings. and they don't receive incentives. So the turnover is very high. You know, you lose like experienced teachers from schools because they tend to move on like for a better job and get hired in private schools. And the fact that the teachers, you know, are focusing on literacy alone, because that's why they're going to be assessed. You know, if like all the class like passed that grade level because they know their alphabets, their grades, their colors, that's it. So because they don't follow like the play-based learning where they will learn like the communication, they're like the motor development, fine motor, gross motor, social adaptive. That's how we assess like the development of our children. So we also have like the tools to evaluate these children. So literacy is not everything. You know, it's education for pre-primary school students is beyond that. So in countries like Ethiopia, where agriculture accounts for the major share of the people's livelihood, research has emphasized time and time again the importance of completion of at least primary school education to earn something. So therefore, its effective teaching methods help to support the social and economic health of the country. So it totally depends on education at some point, because like even if they drop out from primary school, at least they are literate to negotiate if they are engaged like in trade. So if they go like into business, so education is the way.
Thank you. And yeah, particularly that preschool and primary years are so critical for the skills to get on with a productive life and an independent life. And that's the key. Thank you. That was wonderful. I've just heard that Gannet was able to join us. Gannet, thank you for joining us. I'm sorry about the internet, but we have a very specific question for you. And the question really relates to your practical experience in the classroom in Addis, and what you have seen, the transformation that you have seen using a play-based learning style with the preschool children. So what can you tell us about that?
Thank you. Thank you. I have seen some changes. For example, in special needs students are considered as a distractive student in the classroom. Then designing the teachers doesn't designing the intervention plan for them. After the training we gave them, they will make some plan for them. They sit, most of the time, they sit alone without doing something. The other children were playing in outdoor activity. Most of the kids are sitting alone. But now, after the training, we came up with play activities that suit individual children. So the training is more important for them. Many teachers still believe that the best way of teaching is rote memorization, like the traditional way of the teaching method before giving the play-based teaching methodology in our training. So they had slowly changing over the time. We saw that kind of changes in the management. And also the DLP, when we are giving the training, most of the teachers are enforcing the students to motivate their students.
I fear that we may have lost Gannet, but we got the meat of her answer, meaning with the children that weren't right mainstreamed and able to focus in a classroom of up to 50 other preschool students, they would sit and not receive the benefit of the teaching or learning because they were basically ignored, because they needed a more individual lesson plan. They needed more individual care. So the message of Gannet was a very strong one, and I'm so glad that her internet came on and allowed us to hear that from the real front lines of element of play and play-based learning within the preschool setting. So Melissa, I would love for you to talk about how this translates, the play-based learning in our other countries, or how you have seen this kind of transformative change in teaching styles in some of our other country settings.
Yeah, thank you, Claudia. And thank you, Gannet. I know you're struggling with your internet, but it's still so good to see you and have your voice for those few minutes. Yeah, I think I'd love to point out at this moment in time, what I love about WWO programs in all of our countries is that we adapt and grow and change year by year as the politics and strengths of the country evolve. You know, in Ethiopia, we started by running a full primary school for children who had been stigmatized and not allowed into the schools, whether that was through poverty or because of HIV. And the government and the whole society of Ethiopia started to shift, and we were able to get all of those kids registered into public schools and capitalize on that beautiful step in the right direction. And now they're thriving in their in their public school educations. Then we shifted into really running a preschool, a demonstration preschool of what it's like to do play-based learning. And as we had that up for a couple of years, the government finally adopted preschool as a mandatory part of the learning trajectory for children. And so we were able to show the government what we'd done. And now we are invited into public schools where there's preschool for the first time. And so I think this concept, and we do this in all of our countries, where we stay on the cutting edge of science and evidence-based programs, and we adapt them to the local culture and context of each country. And as things shift and change and grow, we adapt to meet those needs. And so when Gannet was saying, gosh, now we're noticing in the preschool that there's children that might have disabilities or are delayed, and they're just left in the corner and they're not talked to. And now suddenly they're doing individualized learning plans. Like, that's huge. But that comes because we're willing to adapt to the situation. So it's fun to hear both Dr. Sophie and Gannet start to share what they're learning in this process.
Amazing. I love that you always interject the transition from where we start in a country and how we evolve with the policies and the readiness of the country to adapt to a new, more effective style of teaching and learning. Thank you. Thank you so much, Melissa. Dr. Sophie, could you talk a little bit more about the challenges that you've seen within the preschools? I mean, you've only been in there a couple of months in the public preschools, but I'd like a snapshot of really what you see as the obstacles that our newly trained public preschool teachers are overcoming while they use the play-based learning. So, and maybe that can help with that. You both can weigh in on that question if you feel comfortable. Thank you.
So probably I can talk about, the challenge we faced when we started the play-based learning project in the government school amid the COVID-19 pandemic. So we managed to train while we were almost in semi-lockdown to train the teachers before school starts, like to save some time. So we have, large number of class size. So we're working with children inside a learning space. Now the regulation is that, you cannot have like so many children in one room, to avoid COVID-19 transmission. So it's very difficult like to do like disinfection every now and then, because the number of students attend the classroom decreased, because like we couldn't take like everybody at one go. We used to have like between 12 and 24 children at some point. Now we have like very few children like sitting apart to maintain the social distancing rule. So COVID-19 has really affected our work, but hopefully, like with if there is like a vaccination rolled out in our country, so probably we'll get back like to a larger size within the learning space. And the other issue is the lack of training, you know, how to assist special needs children within the classroom setting. You know, this is a big issue for the teachers. You know, corporal punishment is still practiced. And, you know, they usually isolate the children. Like if they are like, if they have challenge sitting still in the classroom. And it's a big issue, you know, and we're doing medical evaluation, and we've started seeing children with behavioral issue, developmental delays, but these children are labeled as slow learners without diagnosing the root cause. And, you know, the teachers always complain there is a disproportional number between like teachers and the students. So the ratio is really disproportional. So they cannot give like due attention, especially to children with special needs. And the other issue is like we couldn't do like hands-on training and supervision as much as we want because of the limited number of staff we have. You can imagine like we have over 2,000 children to deal with, and we have to make sure that they benefit from our program. So probably that will be solved in the near future. So these are some of the things that are prevailing during the past 3 months after we started the Playbased learning program.
The question, Gannet, is what have you seen within the public school classrooms as some of the challenges that we need to overcome and to help the teachers overcome by our play-based methodology? What have you seen as their on-the-ground challenges in the classroom?
Okay, I have seen some challenges, like some of the parents tends to have a traditional belief that play is not an important thing. They think that play is a waste of time, and they expect most of their children staying at the classroom most of the time. They prefer to, most the students are sitting all the time in the classroom. Some parents are witness like children playing outdoor and commented, and they believe by saying, how could these kids just be learning? They ask this kind of question for the teachers. And also some of the challenges are, even though our curriculum is developed by play-based learning, but they don't apply in structured way because of some challenges. Like they will be assessed, children will be assessed by literacy skill, and they focus on to pass from to promoted from class to the other class. They focus most of the time for the result, not the process. So we just give some direction for them. Play is important for them, and play is make easier for the teacher work. So in our discussion and in our hands-on training, we give a direction for them. How can they play is relate with their lesson plan? So we give some kind of a direction for them.
Thank you, Gannet. That's so interesting. So the parents believe that a 4, 5, or 6-year-old can sit for 7 or 8 hours without having recess and just learn. And they feel that is the role of the preschool, to have the child sit in their seat and learn at 3, 4, 5, and 6 years old.
Of course.
That is a challenge. I can't even imagine it. Even post-COVID, I can't imagine that being a way that children could even exist within the classroom. And so thank you for bringing that to our attention, and the fact that that is a reality for the 2,000 children that we are touching with the teacher training, and just multiply that by many multiples and realize that children across this country are being taught with that expectation is really awesome. Awesome meaning I am in awe that that would be the reality for these little children and the expectation for their parents. Melissa, I'd love to...
Can I add something, Melissa?
Yes, absolutely. Please do, Dr. Sophie.
So, you know, regarding the parents' involvement, we believe that parents and caregivers are, you know, the key stakeholders in the process of their child's schooling.
100%.
So at the former WWO school, you know, parents work in rotation as volunteers. So they either work like they do some cleaning work, and sometimes, you know, they assist the children to go to the restroom and assist the teacher like in documentation. And, you know, the continuation of care at home is very significant. When they see what we are doing for the children at the school, they go and take the same tradition with them. Like we say, like corporal punishment is not allowed. And we tell them like they have to take some time, even if they're busy, to sit with the children and play. Even during the COVID outbreak, we distributed play kits with a manual for parents and older siblings to play at home with the children. And this is like a big thing that we've done for the family, because, you know, the kids are away from school, they're not happy, and they forgot like what they've learned in the past. They don't communicate with their peer groups. So it was really a challenge. But with what we did, you know, parents are pleased. And since they were coming to the school at least 4 times, we have parents coming in rotation. So they know what to do when they go back home. And, you know, a stipend is also provided to the parents, you know, in order to lessen their economic burden. So this had an amazing impact on parent understanding, development, and schooling as well.
Excellent. Thank you, Dr. Sophie. I think bringing the importance of the stakeholder as parent is a very important part of the conversation. Thank you for weaving that in. That's critical, and that has always been a part of the success of WWO's work with children. It's always about being very front and center with the caregiver as well. Thank you. I think as our wrap-up question, I'd love to talk about hopes and dreams. And Melissa, I'd also love to give you an opportunity to bring in the other WWO countries into the conversation and really respond to what we learned from Dr. Sophie's comment about stakeholders and parents and the importance of them being woven into our work.
Yeah, thank you, Claudia. And Sophie, thank you also again for bringing out the parent piece of that. When we ran the preschool ourselves, we had that opportunity to engage parents. And like I said earlier, I think WWO is on the kind of the cutting edge of shifting mindsets across our countries. And so in the public schools, we are not only shifting the culture of the classroom from fear-based learning to bringing joy and laughter and movement and play in. We are shifting the way teachers and children are engaging with each other rather than through corporal punishment or isolation or just kind of sitting and being still. We're shifting that into a dialogue, an opportunity for teachers to ask questions, children to answer, and a kind of a more of a back and forth. And we're also now trying to bring parents who've often been left out of the equation in Ethiopia and across our countries inside the education system, bring them back in, connect them to what their child is learning in school, to then bring that learning home with them, as Dr. Sophie mentioned. And that's something that we're doing across our countries in our work in the preschools, in our work with communities, always looking for a way to engage the child, their family, and then the community, and working our way out. I did want to also mention briefly that in both Ethiopia and in Haiti, in our work with preschool children, we use the Ages and Stages questionnaire to kind of provide an opportunity to see the baseline of how children are developing before we start the program. And then after, 1 year, 2 year, 3 years of work. And when we launched the ASQ in this beginning of the school year in, September, October?
Yeah.
We had 65% of students, the preschool, 3, 4, 5-year-olds coming into the preschool with severe delays in their development, and only 2 children, or 3% of the 74 student population size that we've got so far. 2 children were on track developmentally. I'm excited now for the end of the school year to be coming close. We'll do another ASQ in May. And so we should have some really exciting new data to present back to all of you watching, listening, learning, to really see the impact of our program on the trajectory of these children and their learning and growth and socialization, and how play has impacted their trajectory.
Thank you. Thank you so much, Melissa. I'm very excited to see the results of that because I know that our program has such a dramatic transformative effect, and so quickly. It's mind-boggling how quickly the change occurs. It's almost like the children have been waiting to be taught in this way, and then they just absorb everything so beautifully, and before you know it, they're completely up to the developmental level that they're supposed to be at for their age. Thank you, Melissa. Dr. Sophie, I'd love to again wrap up with hopes for the future and how our program will help transform how teachers are empowered to teach their students.
So in the future, our hopes are, we've already signed an agreement with our government stakeholders to reach 8 more schools by the end of 2023. So that you can imagine that the number will increase like probably 2-3-fold. And also the number of teachers that will be trained will also increase at the same time. So we are committed to work with the schools to address and support and finding solutions to the myriads of challenges that have been presented earlier on. So, but as I told you, so there's a lot to be done by the policymakers, because preschool was given attention very recently. They don't even have like enough budget to have like enough spaces. It's a good thing that they have now a school feeding program, but the number of teachers has to increase. They need to be trained, but we will work as a team with our partner school, like to help them reach their goals. And last but not least, besides the establishment of the learning space, we've been doing like basic medical evaluation for the preschoolers. So to our surprise, we have found like so many problems that hampered their learning capacity. So as I told you earlier, they're labeled as slow learners because they have severe ear infection. You can see like ear discharge, like from both ears. The child sits there like the whole day without listening anything. You know, listening is like very important in the learning process. So we have kids that have like strabismus, like squinting of the eyes. And we found like one child with autism spectrum disorder. Another child has like severe developmental delay. So we're trying to link them like with government health institutions for them to follow up there and have like solution for their problem. So this is what we are hoping where our program will be in the next few years.
Thank you so much, Dr. Sophie. And I think I need to point out that with your pediatric specialty, we are able to bring an extra layer of healthcare oversight to the children. And you've brought in 3 of the school nurses, as I understand, to do a health check on every single student within the school under your supervision. And that is something that I'm glad you pointed that out, because it is critical. You can't ask a hungry child to learn, and you can't ask a sick child to learn or to sit for 8 hours. So this is a critical point. Thank you so much for bringing that up. And I think when you talk about going from 80 teachers to reaching 2 times more teachers in 8 schools from our 4 schools, we're talking about the multiplier effect of training professionals, because what we have given them in their new knowledge, they will not only bring to the students that are in front of them this year, they will take that knowledge, build upon it, and bring it to every student they work with and every student they teach for years to come. So the multiplier effect of what you are doing, training these teachers, should not be overlooked, because it is something that will continue to reap the success and the achievement of the students in the future. So thank you so much, Dr. Sophie, for being here, for talking about this transformative work that you are doing with your team in Ethiopia. Thank you, Melissa, so much for giving us the view of what we are doing and how this relates to the other countries that we work in. This has been a wonderful discussion. I always learn so much from what we discuss in these webinars. And thank you both for being here. Please thank Gannet from us when you see her. Her feedback and her perspective was valuable and something that we all needed to hear from the classroom and from the ground in Addis. So please thank her from us. Take care and be well. Thank you all.
Thank you for having me.
Thank you.
Thank you. Bye.